Hi, everyone. Welcome to our last lecture of week two, where we're going to be looking at a few examples of advocacy and how some advocacy efforts have worked, and look for some lessons learned from some historical examples. So our objectives here are the same. And I wanted to bring forth a few examples of advocacy when it comes to civil and social justice. I think that these are three really good examples that we can all probably relate to and have heard a lot about. The civil rights movement with Martin Luther King, the movement for Indian independence from British rule with Gandhi, and the LGBTQ rights movement. Um, and you can see an image above of a Stonewall march. And what we can see from all of these examples is that there was some level of social movement that came together that resulted in widespread public policy changes. And we can see also that all three of these examples we can see took a very long time, and there was a long period of stability where there were small changes that did not make much of a difference in what these three individuals were advocating for. But when they were able to bring forth and bring together large social movements, they were able to create change and create uh, at least progress towards the positive change that they wanted to see. Right now, we can see that there's still conversations around specifically civil rights and LGBTQ issues. Even in our society today, there are still a lot of conversations around these. So that will be a common theme that we will be describing throughout this lecture, that advocacy takes a long time, but we should recognize that. We should realize that it takes time and not let that beat us down when we do not see the results that we hope to see immediately change. We should recognize that we need to keep up our strength and continue to advocate for the change that we want to see within the healthcare system. So I want to bring forth an example that we will be around a topic that we'll be talking a lot about throughout the course of this semester, because there's a lot of advocacy around how we pay for healthcare. And I want to specifically talk about our public healthcare system here within the US, and that is our Medicare and Medicaid system. And I specifically want to talk about this because behind the creation of this system, there was a huge advocacy campaign, but it took a really, really long time. It was similar to the civil and social justice issues, that those advocacy issues took a long time. We can see comparatively to some healthcare issues as well, that a lot of these advocacy issues take a long time as well. But they eventually are able to create change when they're able to bring together social movements and more individual stakeholders and advocates to support an issue. So just for a quick review of what Medicare and Medicaid is, Medicare is a federally funded healthcare system. It's federally funded, so it's a national healthcare system. And what it is it provides a certain level of insurance for certain individuals within our society. Those individuals are people that are greater than or equal to the age of 65, some people with disabilities, and then people with end-stage renal disease. So we have a public health insurance system. We also have a lot of different types of private health insurance, but we're specifically talking about public health insurance because in order to create a public health insurance system, it requires legislative change, which we'll be describing here when we talk about the advocacy efforts that went behind this. The Medicaid system is both a federal and state funded program. So it's both funded through national efforts, but it's largely managed on the state level. And that is for individuals that have low incomes. It's also for children, and it's for people with disabilities. Now, we'll learn a little bit more about the Medicare and Medicaid system later on in the semester, specifically from several expert interviews, but just wanted to give you a background into this for the purpose of this example. So the law that created Medicare and Medicaid was signed into law in July 30th, 1965 by President Lyndon Johnson. And for many individuals, that's where Medicare and Medicaid started. It started when that law was signed in July of 1965. But there was a lot of efforts that went behind that for several decades before that finally resulted in this big win for the health insurance system. So an advocacy timeline for Medicare and Medicaid shows us that the efforts didn't start in 1965. They started actually closer to 1915 when we saw initial reformers and advocates working with members of their state legislature to try to introduce legislation that would reform and create a system similar to Medicare and Medicaid. Unfortunately, those reforms failed, but they continued their efforts for several decades. And in 1935, there was consideration around when the Social Security Act was being signed by President Franklin D. Roosevelt. There was consideration around including some language in the Social Security Act that would study health insurance to see if there was any interest of the creation of some sort of health insurance system within the United States. Prior to the Medicare and Medicaid system, there wasn't a public health insurance option for many individuals. However, this was largely removed due to opposition from the American Medical Association. And after that, there was not many efforts that came forward for several decades, or for at least over a decade. In 1949, President Harry Truman called for universal health care. So this is coming up again, largely because of advocates advocating for this type of healthcare system. But it was strongly opposed by the AMA, again, the American Medical Association. And we saw that, again, it did not move forward. Now, the reason that this was opposed by the American Medical Association, frequently we see the reason why this was opposed by them, was because there was concern from physicians at the time that it would create a public physician network, and physicians would not have the independence to practice independently anymore. So there was concerns around the creation of a health insurance system for those reasons, which is why the AMA opposed it. And the AMA had a lot of strong advocacy support, and they still have a lot of really strong lobbying and advocacy ability on Capitol Hill. In the 1960s, reformers pivoted what they were thinking about potentially creating. Instead of creating what was previously being discussed as more of a universal health insurance system, reformers started focusing more specifically where there was the greatest need for health insurance. And they identified that individuals that were elderly really lost what at the time, there was a big gap in their ability to receive healthcare and health insurance, because at the time, health insurance was largely only tied to employment. And after individuals retired, they lost their health insurance, despite the fact that they really needed health insurance as they grew older and they weren't able to afford their health care. So reformers began focusing on elderly and linking federal health insurance to Social Security, and began to work to gain public and congressional support. And reformers really started to build a social movement around this and began advocating to help increase public opinion on this issue. In 1964, unfortunately, again, a Medicare bill failed to pass out of a committee, and did not pass into official law. But in 1965, because they were able to bring together so much support, so much advocacy for this, they were able to eventually sign into law Medicare and Medicaid. And it was passed and signed into law in July of 1965. So, what we can see here from this example are three important concepts that we need to be remembering when we come and think about social movements and move forward in ways that we need to think about how we can advocate for issues. We need to observe from history that substantial change takes a long time. We've already described that we have these long periods of stability and then these small moments of radical change, and that we can do things to help increase chances of positive change coming together by empowering individuals around us to participate in conversations and political activities. But substantial change still takes a really long time. Uh, we have seen that substantial change comes when social movements are formed. We've talked about the philosophical and ethical considerations of social movements, and we've recognized their power in helping to create those moments of radical change. But we also need to recognize, and we can see this specifically from history, that failure is a part of the journey to success. That if those reformers and advocates in 1915, when their original bill failed to pass a universal health insurance system or a Medicare type system, uh, if they had said, well, we failed, it's not going to work, it's never going to work, and we're never going to try again, then we wouldn't have the current health insurance system that we have today. And albeit there's opportunities for improvement, but because we have the Medicare and Medicaid system, a lot of individuals have health insurance that maybe wouldn't in another system. So failure is a part of the journey to success, and we need to recognize that and respect that, but not let it get us down, because we can work past it to reach the goals that we want to reach to improve our healthcare system. So I've got some references here, but that'll wrap up week two. Hope that you all enjoyed this content, and really looking forward to seeing our discussion posts and everything that we'll do moving forward in week three. Thanks, everyone.